Welcome to PAR Podcast, episode 75.51. PAR Podcast is an audio supplement for Public Administration Review, the premier professional journal in the field of public administration. This year, 2015, PAR celebrates 75 years of furthering public administration research, theory, and practice. This episode features comments by Philip Rocco, a doctoral candidate in the Charles and Louise Travers Department of Political Science at the University of California, Berkeley. Philip discusses his article, co-authored with Lars Tummers, an assistant professor of public management and public policy at Erasmus University Rotterdam, titled Serving Clients When the Server Crashes: How Frontline Workers Cope with E-Government Challenges. This article is currently available on Early View and will be printed in Public Administration Review, Issue 75, Volume 5.
In our research together, my colleague Lars Tummers and I tried to answer the following question. How did frontline workers cope with the challenges of implementing a major e-government reform, the Patient Protection and Affordable Care Act, or the ACA? So to set the scene, the movement towards e-government began about 2 decades ago. And at the outset, the idea was to use digital technology to improve citizen access to public services, enhance the accuracy of service delivery, and also minimize the costs of government. And so this involved taking frontline workers out of the equation and creating a direct link between government and citizen in the form of digital technologies. And so the image of e-government you probably have in your head is of someone signing up for public services using a government website. So frontline workers were not initially envisioned as part of e-government, and they appear in very few studies of e-government implementation, but they've increasingly emerged to deal with all of the challenges that e-government creates, and I'm sure you're familiar with them. So things like technical glitches, client confusion about benefit eligibility, and in the case of insurance, client confusion about the nature of benefits themselves. These frontline workers are not government employees as they might have been in the past, but they work in nonprofit organizations often that support public service provision. So for example, during the ACA's first open enrollment period in 2013 and 2014, more than 28,000 individuals working in community health centers, legal aid offices, and other organizations helped an estimated 10.6 million people gain access to coverage. So to understand how these frontline workers dealt with the challenges with implementing the ACA, Lars and I used a new analytic framework for studying coping. And the framework distinguishes between 3 basic types of behaviors that frontline workers engage in to cope with the challenges they face with their clients. And these include moving towards clients, moving away from clients, and moving against clients. And each of these different types of coping has really different implications for how clients experience public policy. So first, moving towards clients, you can see this as pragmatically adjusting to client needs, so coping in the client's interest. For instance, you might imagine a social worker who has to deal with a client who is struggling to make ends meet, but also doesn't qualify for public benefits. In this case, coping towards clients, the social worker might take the strategy of giving the client some of her own money. Now, that might sound like an extreme example, but it's one way in which a frontline worker can cope by moving towards clients, identifying a problem, and then doing what she thinks is in the client's best interest. Second, moving away from clients happens when frontline workers avoid interacting with them. So a police officer, you can imagine, might say, the office is very busy today, please return tomorrow, or might ration attention to reports of crime. And this is moving away from clients, so behavioral avoidance often. And third, moving against clients describes situations in which frontline workers engage in confrontation. So you might imagine a caseworker refusing to see a client who shows up like 30 seconds after their scheduled appointment, rigidly following like an on-time appointments policy. That can be seen as sort of moving against clients or engaging in some kind of confrontation. We used this 3-part typology to analyze data from interviews with 25 frontline workers, 12 in Minnesota, 13 in Wisconsin, who were assisting clients during the ACA's first open enrollment period. And these are navigators, certified application counselors, and in-person assisters. And you can read more about our interviews and our techniques for validating the findings in the article. Our data revealed three really interesting patterns in how frontline workers cope with the challenges of delivering e-government. First, we found that very few frontline workers that we interviewed coped by moving against or moving away from clients. Where we did find instances of rationing attention only in about 6 of our 25 interviews, it was mentioned as a last resort. So as one navigator in Minnesota told us, she felt it was important to devote as much time as she could to each client, in part because a lot of people can't advocate for themselves. So second, we found that frontline workers tended to cope with challenges by moving towards clients. And there are numerous ways of doing this that we found in the article, but the two we found most commonly are learning and collaborating. So 22 of our interviewees took the time to learn about how to solve client problems with accessing online insurance marketplaces. And this learning happened both on the spot during client meetings and also systematically over time analyzing what went on in those meetings. Often we heard about frontline workers describing their organizations as having a healthcare nerd culture in which familiarity with the market and associated regulations is sort of a common source of support for when individual workers don't really know what to do. They can go learn about it. In Minnesota, for instance, navigators, when they ran into problems, developed training manuals, including PowerPoints, tip sheets, and guidebooks that filled in the gaps in their knowledge left in the training for navigators provided by the state. So if navigators, as one told us, knew their stuff, they'd be better able to contest erroneous rulings by state agencies and serve their clients. In 21 of our interviews, we also found that frontline workers collaborated with others in formal interorganizational networks made up of their peers, but also representatives of state agencies and insurance companies. And these networks provide a resource for on-the-spot challenges that workers face. So it's a series of phone numbers that workers can call. But they also allow frontline workers to get together to recognize broader problems with enrollment and then collectively develop systematic solutions that cover those broader client populations. So navigators in Minnesota recognized a problem with enrollment for clients who were recent immigrants to the United States. And so in these networks, collectively developed a manual and then distributed it regionally and also nationally. Networks also, I think, allowed frontline workers to develop trust with their clients and tap into infrastructure resources they didn't have. So one navigator in a really remote rural part of Wisconsin told us that her organization developed links to organizations that already existed and clients knew, so like churches and chambers of commerce. But more than providing trust, these organizations gave their organizations space to hold longer informational sessions with an aging population that had lower computer literacy and needed a little bit more time. So the group also developed links with cable companies, for instance, that could provide stable internet access in a location where that's actually a problem. Third, we found that whatever coping strategies they used, frontline workers experienced considerable strain from their work. And this strain is potentially because moving towards clients is not always beneficial for frontline workers. Interviewees in both states reported a lack of resources and an almost constant pattern of overwork, especially during open enrollment. And so we heard several reports of a presumably talented worker quitting because he or she couldn't take the stress of the job. These findings, I think, suggest two key takeaways for policymakers and practitioners. First, governments developing e-government policies should learn from their frontline workers. These frontline workers that we interviewed really had a wealth of knowledge about all of the challenges of implementation, a really day-to-day working knowledge. And they've also found ways to cope with those challenges that are beneficial for clients. And we think that sending this knowledge upwards, as it were, can help improve implementation. So for instance, governments can use the knowledge of frontline workers to restructure rules that in practice prove to be unjust or unclear or simply inadministrable. Second, we think that frontline workers have resources at their disposal to deal with e-government challenges, even if they don't have direct control over computer interfaces or they lack technical expertise. Rather, They have the capacity to interpret rules, to learn about problems, and to collaborate with one another in ways that help clients get access to services. And we think that spreading this knowledge would significantly improve clients' experience of public policy.
This concludes PAR Podcast, episode 75.51. To listen to additional episodes and learn more about Public Administration Review, please visit us online at publicadministrationreview.org. You can also find us on Facebook and Twitter at PA